Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, December 7th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. We are continuing to roll out the TO Supports COVID-19 Equity Action Plan. This plan is a targeted response to COVID, which has the city getting help to the neighborhoods who need help the most right now. And we are treating this urgently. We do need the support of the federal and provincial governments, and that support has been requested, and we need their help with this plan in particular, but we're not waiting for that requested funding to come. Toronto City Council pushed ahead with this plan so that we can help expand testing sites, increase community education and engagement through on-the-ground community agencies, and advocate for help, for example, with evictions and other emergency supports. One of the key actions of the plan was helping increase provincial testing efforts in communities where it is needed the most. This included, in particular, more testing, easier access to testing, and more direct outreach to convince people to get tested. We have been working with the Central Local Health Integration Network, the LIN, in the city's northwest to help expand testing by using reconfigured TTC buses for mobile testing facilities. The LIN is working with us to put these buses into use for mobile testing starting this week. This would bring the testing right to people, and we're working to expand this to other areas of the city as well. This is a truly team effort that includes healthcare providers, the TTC, and the Toronto Paramedic Services, and I thank them all for coming to get to this task so quickly, because it is urgent that we pay special attention through the equity plan to these neighborhoods hit the hardest by this pandemic. It is one example, the buses, the mobile testing facilities on reconfigured TTC buses, of the extra effort we will make through the Equity Action Plan to address the huge impact that COVID-19 has had on some of our already marginalized communities. This will see us do better for the residents of those neighborhoods, and it will help us in our overall efforts citywide to help stop the spread of this virus. I want to encourage people, because we can't say it often enough, I want to take the opportunity today to encourage people again to support local restaurants and shops. Please order takeout or delivery from restaurants and buy local from shops using curbside pickup and online options. I know not everyone has the resources to do this in the case of ordering out or getting takeout food, but for those who do, I strongly encourage everyone who's able to do so to do this at least once a week. And Wednesday's a good day because we call it Takeout Wednesday, but please pick a day this week, or more than one if you can, to support these businesses who are struggling in the cause of stopping the spread of COVID-19. Each and every order you place with a local restaurant and shop will help them. It produces revenue for them in addition to the government assistance programs that they are hopefully taking advantage of. Each and every one of these orders helps them with revenue at this time of year when they counted on so much opportunity being available to them. We are getting closer and closer to getting through this pandemic. Planning for a vaccine is underway, which should give us all hope. But we know that COVID-19 still remains a serious threat to people right now. The numbers, which you'll hear more about from Dr. de Villa, are grim, and we know that they would be far worse if we hadn't taken the unprecedented measures we have taken based on the best available public health advice. We can see that clearly from places where they have not implemented any public health restrictions and see what the difference is in terms of the experience they're having with the spread of COVID-19. We just have to keep doing the right thing to save lives and stop the spread of this virus in our city. So please keep following the public health advice. Stay home as much as possible. Only go out for work or school or essential shopping and exercise. Wear a mask, wash your hands, and if you have symptoms, please get tested and isolate. This is basic but extremely important advice, more important than all the rules that we could ever bring forward in legislative form. This is personal behavior, and it's going to be extremely important, as it has been throughout, to getting through this nightmare. I would now like to ask Dr. de Villa to give her report for the day.
Thank you, Mayor Tory. and thank you in particular for your review of TO supports. From a public health perspective, I wholly support the COVID-19 Equity Action Plan. It is vital for producing real change at the community level to address the heavy price being paid in neighborhoods where COVID-19 is striking hardest. I'm reporting 651 new cases of COVID-19 today. 227 people are in hospital as a result of COVID-19, and 57 people are in the ICU. We are now less than 20 days from Christmas Day and a week into a month traditionally filled with celebrations and observances in many faiths and cultures. This year cannot be as usual. December is 7 days along, and we have reported just slightly more than 4,100 new cases of COVID-19 and 68 deaths from it. The case counts are so high that I can only call this a very, very serious situation. There is no way to argue otherwise. COVID-19 is spreading aggressively in Toronto. On December 1st, we had 761 reported cases. Then followed 438 cases, 421 cases, and then 671 cases. On December the 5th, 550 cases, then 609 cases yesterday, and 651 cases today. I do not want to contemplate what the case counts might have been had we not entered lockdown. I am worried about the threat to our own health, and I'm worried about 3 real risks manifesting in the healthcare system. First, the increasing need for COVID-19 related care. The virus is steadily sending more people to hospital in need of treatment. Even cases that recover at home are regularly described as rough enough. The increasing need for hospital care should be something we all take seriously. The virus is sending more people to hospital. Second, with more COVID-19 care required in hospital, the risk increases for people who provide that care. Paramedics, technicians, nurses, doctors, all hospital staff. The system relies on these people. We rely on these people. We need them to be well and able to do their jobs. Finally, the impact on other healthcare services. As COVID-19 related care diverts resources, the rest of the system slows. Risk can increase. Discomfort, pain, and disability can drag on. The more we can do, those of us who are well, to stay that way, the more we do to protect these vital resources. We owe it to the healthcare system, which we all treasure. In our own lives, risky in-home festivities will easily make things worse, and already I'm as worried now about what may happen in January as I am about the rest of this month. Contact between people, especially from December 24th to New Year's Day, could easily amplify the number of infections we're seeing right now. The guidance from the province advises that the safest way to spend the holidays this year is by celebrating only in person with the people you live with and celebrating virtually with everybody else. If you live alone, consider exclusively celebrating with one additional household. Of particular concern will be the return of university students coming home for the holidays. Here, the provincial guidance is that individuals living away from home, including those studying at colleges and universities, should consider doing a self-quarantine or reducing close contact with others 10 to 14 days before returning home for the holidays. I agree that all of this is the right advice. I do not believe that it is safe to do otherwise. I do not believe that it is worth it to do otherwise. I can't be any plainer than that. The advice is designed to strengthen the things we know that work, keeping as much as we can to our own homes and the people we live with. Keeping a distance between ourselves and others is not just measured by 6 feet or 2 meters. It's also measured by the time we spend with others and who those others are. When we have to be out, then the 6 feet or 2 meters is the measure that matters, by at least those 6 feet or 2 meters. The greater the distance, the better off you are. And this is when we have to wear our masks and wash our hands as much as possible. Our beliefs, faiths, and cultures mean December celebrations vary. But whatever their distinctions, most share in common time and occasions that bring us into close contact. And after this long year, everyone's vulnerable to the need to relax and forget. So if your holidays usually involve lots of time with friends and family, please start thinking now about the change you will make for your own safety and commit to those changes. Making the best of a very different holiday season, like so much this year, demands that we do things differently. Human nature being what it is, this isn't an easy commitment to make, and it's going to take some time to get used to. I think I can speak for all of us in saying that what we want most this year is for all this to be over. And we can get there if we make the choices that this moment demands. By joining together in staying apart, we will deliver a safer holiday in 2020 that positions us for the holidays and the everyday lives we want in 2021. With that, I'll now hand it over to Chief Pegg to deliver his remarks for the day.
Excuse me. Thank you, Dr. de Villa, and good afternoon. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. Our coordinated COVID-19 enforcement team has been working tirelessly for the past 9 months enforcing the regulations relating to COVID-19. This includes proactive inspections, responding to complaints, educating the public, and when necessary, issuing tickets and laying charges against those businesses and individuals found to be in violation of the law. The City has taken formal enforcement action 1,693 times to date in response to COVID-19. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. 228 bars and restaurants were inspected this weekend, resulting in a 99.5% compliance rate. Only one was found to be non-compliant, with action being taken by the investigating officers. We also received 73 complaints related to non-essential businesses. In response to these complaints, and following inspection by our enforcement teams, 3 charges were laid in response to violations of the Reopening Ontario Act. This included a number of different types of non-essential businesses, including giftware and furniture stores. We received 98 complaints relating to gatherings on private property over the course of the weekend. 3 charges were laid by Toronto Police under the Reopening Ontario Act as a result of the investigation of these complaints. It is important to note that this is roughly half as many complaints as we received last weekend, which is deserving of our collective acknowledgement and thanks. We did not experience any significant issues in our Toronto parks over the course of the weekend. I want to thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city. Your actions are helping to save lives, prevent the transmission of COVID-19, and prevent our healthcare system from becoming overwhelmed. Unfortunately, we responded to 9 fires in encampments over the course of the weekend. This included responding to a fire involving a foam-based pod in HTO Park on Queens Quay. These pods are constructed from expanded polystyrene insulation, which is a highly flammable product not intended to be used in this manner. When these polystyrene-based pods are exposed to heat, hot surfaces, sparks, open flame, or other ignition sources, they represent an immediate threat to life for those occupying them. Polystyrene burns rapidly and vigorously, and when it burns, it produces very thick, black, toxic smoke. Firefighters require specialized protective equipment to fight fires involving these products as a result of the hazards that exist when polystyrene burns. I want to be very clear. These pods are not a suitable nor safe means of shelter and are not a suitable alternative to safe indoor housing. The city has helped more than 1,100 people move inside from encampments since the pandemic began, and we are continuing this important work every day. I would like to extend my sincere thanks to our shelter support and housing and our parks, forestry, and recreation teams for their continuing work to support our most vulnerable residents. Our teams are working hard to educate Toronto residents about the significant danger that results from occupying one of these makeshift shelters or pods. Where we observe evidence of an immediate threat to life, such as proximity to a potential ignition source, we will take the necessary action to eliminate the risk without delay. Fortunately, there were no injuries as a result of the fires over this weekend. Tragically, though, one person has already died in an encampment fire in May of this year. In total, 7 people have died in encampment fires in Toronto since 2010. In 2020, we have responded to 226 encampment fires, which is a 228% increase over the same period last year. I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. There are a number of staff on the line. Should you have specific questions, including staff from Shelter, Support and Housing, from Parks, as well as from the police. First up is Sabrina Jones from CBC Toronto, and please ask you all to unmute yourselves on your end. Sabrina, go ahead.
Hi, good afternoon. Thank you for taking my question. Mayor Tory, on Friday, CBC Toronto broke a story about the lobbying firm Sussex Strategy Group paying someone in cash to campaign for 9 councillors during the 2018 election. Unless someone went public, that money and influence would have remained completely hidden. So my question is, what do you think about this situation, and would you support the Ontario government tightening the Municipal Elections Act to stop this kind of thing from happening in the future?
I think the entire area of people who get paid by somebody else to work in election campaigns is worthy of further examination. There have been lots of instances as well in which people, for example, from the labor movement have been loaned, shall we say, full-time and paid for to campaigns, and I'm not sure ever how that's exactly accounted for. There are these instances we've now heard about, which I can't speak to directly, but there seems to be a lot of research done to establish that this actually happened. And so I think the notion of looking at this in the interests of transparency and in the interests of a system that is fair is something worthy of consideration.
Thanks so much for that. My second question, today over 30 individuals made deputations to the Economic and Community Development Committee about encampments. One of their demands was that the city open at least 2,000 new shelter hotel rooms in the next 4 months. I want to ask, is the city able to provide this?
I think a lot of the deputations today were based on false premises with respect to what the city's plans were, with respect to housing homeless people. We've been working in a very determined, very devoted way to housing so far 1,100 people out of encampments into other forms of housing. There's a few hundred left, and I'm not trying to minimize that number, but I think the numbers say around 400 that are in the encampments now. And we continue to follow the policy that we have been following, which allows us, because we had a winter plan put in place by the officials, to go to the encampments, to give some notice of the fact that we think that they're not safe, they're not healthy, and that people need to have alternate forms of housing, to offer different options in that regard, and to then make sure that that's made available to those people. And I think that policy has been working quite well in that we have actually rehoused 1,100 people. So, and I want to say one more thing, which is that I have absolute confidence, complete confidence in our public service staff who've done a miraculous job at rehousing 3,000 people out of the shelter system for physical distancing reason and housing these 1,100 people who are in encampments. And so we will do what we have to do to make sure that some of these most vulnerable people are protected. But I think that it's best when we have a discourse at City Hall, including those who depute, that is based on facts and that is based on due consideration for things like health and safety and so on. And I give that answer as an elected representative, and it may well be that some of the public servants who are on the line wish to add to that.
Yeah, I'll ask Laurel Rain from Shelter Support and Housing, who is with us today. Laurel, is there anything to add to that, please? You'll need to unmute yourself, Laurel. Thank you.
No, I don't think anything else to add other than that, we activate our winter service plan, which provides up to 620 new spaces that are being operationalized, and as well 4 warming centers this year, which is more than we've ever had over the winter, that will be activated during extreme cold weather alerts to ensure there is space for people to come inside over the winter.
Thank you very much, Laurel. We'll go next to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thanks so much. My first question is for Dr. de Villa. During the first week of this second lockdown, Dr. Williams intimated that it would likely be extended, and given the results of a poll conducted by the Angus Reid Institute that shows 27% of people in Ontario will visit loved ones locally outside of their households over the holidays, and 8% plan on traveling out of the province, we are likely to see the numbers increase the first 2 weeks of January. So are you already making an argument to keep us in lockdown until February, and are you prepared to say that will be the case?
So I think that's an interesting question, and it's helpful to have that background or context around what polling data is showing. I would say this, thinking about the remarks that I've just delivered today and the numbers that I've put forward, we are clearly in a very, very serious situation. And we know it's not just about numbers. It's actually about the consequences of those numbers, many of which are very specific impacts on our healthcare system, the healthcare system that we all very much rely on and that we do indeed treasure. We rely on this system, the healthcare system, to keep us healthy, to be there for when we need it, whether it's COVID-19 or otherwise. So while I think it is too early to make pronouncements around how long our restrictions should be in place, and certainly it's too early to make predictions around, holding restrictions in place until February. I think what is well within scope for all of us is to really think very seriously about the changes we need to make to our routine holiday celebrations and festivities, as difficult as that is. I think we need to think about ourselves and our own safety. And I think we need to think about the safety of others around us and what kind of community we want to live in and what kinds of contributions we wish to make, not only to the health and safety of us, our own selves and our families, but those around us. And I'm hoping that people will make the right choice. They have done it before. We have been successful together. When we join together to actually stay apart, we know that this actually works. This works to reduce COVID-19. It works to enhance and protect the health and safety of ourselves, our families, and our community. And that's what I would ask people to do.
Thank you. And my follow-up is also for you, Dr. de Villa. We're just looking for clarification regarding college and university students. So you're saying that perhaps they should quarantine for 14 days before going home for Christmas, but some of these students will be done school on the 18th. So are you suggesting they stay at school until the 21st?
So actually, this is provincial advice, and it's to the greatest extent possible to start limiting close contact with others, or undertaking what's described as a self-quarantine to the greatest extent possible, right? This is all about minimizing risk. And I recognize that there are all kinds of individual situations and specific circumstances that general advice will never be able to account for every single circumstance. But the idea basically is to minimize as much social interaction so as to minimize risk when they actually come home. And there are lots of details spelled out in the provincial guidance document, which I would encourage people to have a look at so that they can understand and make sense of the advice in their own unique family circumstances.
Okay, thank you. We'll go next to Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. My question is also for Dr. de Villa, but just before that, I'd just like to, on behalf of the press gallery, offer our condolences to you and your family. My question is, on the subject of lockdowns, we're about halfway through, and to many people, looking at the numbers, it probably doesn't really seem like much is being accomplished because the numbers do continue to grow. I'm just wondering what you would say to them about positive signs that you're seeing so far, if there are any, and you said that you don't want to think about what position we'd be in without a lockdown, but could you just sort of describe some of the things that really are up in the air there?
Well, first of all, Matt, thank you for the kind words of condolence. More to your question, the interesting thing when we talk about measures that are meant to prevent, it's always difficult to describe what didn't happen, what the numbers might have been had we not put restrictions into place. But when I look at that which has been achieved thus far, and I think about the circumstance, looking at the numbers, not just the day-over-day case increases, but looking at outbreaks in particular, we have been able to hold, outbreaks to a reasonable level. When we look at active outbreaks across the city, and I would encourage people to visit our website and to look at our dashboards to see what is happening. We know that we have been able to hold the line on a number of these settings, and in particular, I would look at, whether it's long-term cares, retirement homes, hospitals, certainly an improvement relative to, not perfect by any stretch of the imagination, but, through the combined efforts of many, many people in the healthcare system, in public health and beyond, we are seeing, fewer really large-scale outbreaks in those settings, as challenging as it is. The same thing can be said for schools. Yes, there are challenges within the school context. But when you think about the City of Toronto and the number of schools that we have roughly 1,200 schools in the City of Toronto. And at this point in time, 24 active outbreaks in our schools in Toronto. A relatively small fraction. Not to take away from the seriousness of outbreak at all, but it is an incredible effort on the part of schools, school boards, school communities, all the staff, and certainly staff within public health as well, to maintain those numbers at that relatively low level. So I do think we have seen some signs of success, and that we should take some solace in that and use that to help us commit yet again to continuing on with those measures for self-protection, which are in fact measures for community protection.
Thank you. And just to follow up from Haley's question, I know you didn't want to speculate on as far ahead as February, but with about a couple weeks left on this current lockdown, with the serious nature of the case that you're seeing, do you anticipate that you could see the possibility of this current one at least extending into January?
I think, as has always been the case, it's in our hands, right? It's in our community's hands, all of us. What happens on the go forward until such time as vaccines are made available is really up to us. To the extent that we are able to really commit to staying home as much as possible and limiting our contact to those with whom we live, this is really what will determine how much community spread there is, how we're able to manage COVID-19 within our community, and fundamentally as well, to protect our healthcare system. If you talk to our healthcare partners here in Toronto and beyond, they are seeing an increasing number of people presenting and requiring hospitalization, a number of whom require that intensive level of care that's provided in an ICU. We really must do our very best to protect these healthcare resources. We all rely on them, and so it is up to us to continue to really press on those self-protection measures, those community protection measures, so that we preserve our healthcare system and that we have the best chance at getting back the lives that we want to have in 2021.
Thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jennifer.
Hey there. I wanted to ask Dr. de Villa, and it might also be a question for Chief Pegg, about one of the new reports on the Board of Health agenda. It's asking for funding from the Ministry of Health for the immunization rollout. It says for things like technology, staffing, and logistics. And I'm just wondering if you can elaborate on what those things are and what we need the money for to be able to help with that rollout.
Well, why don't I start, and I'll see if the Chief would like to add anything further. Certainly, it's been our experience in previous pandemics that this is the kind of thing that the Ministry of Health, the provincial government, has assumed financial responsibility for. And we don't have any reason to suspect that this should be any different. It is an important health care undertaking as part of addressing a pandemic. So as you can well imagine, there are all kinds of things that are necessary in order to effect an immunization clinic or a mass immunization response. Everything from the physical space, the tables and chairs, believe it or not, need to be acquired so that you actually have a space for patients to come and sit down and interact with the healthcare providers, who also need to be accounted for. And yes, we do want an information system in order to record, what dose was given of what product to whom at what time, so that there is this ongoing medical record that is part of the process. So it's no different than any clinical interaction that would happen, although obviously it is set up as a mass immunization endeavor, and therefore there are a little bit, there's more by way of infrastructure costs because we're not using existing, say, for example, clinical spaces. These are new spaces that need to be established, not dissimilar to what we saw in 2009 in the H1N1 influenza pandemic.
Excuse me, Jennifer, what I can add is just, I think it's important to clarify and just establish the function, if you will, of each of the respective levels of government. The Government of Canada, of course, is responsible for approving vaccines for use in Canada and then procuring and distributing those vaccines to the province of Ontario, in our case. The province of Ontario, of course, receives the vaccines from the Government of Canada. They prioritize the rollout and distribution and then ultimately provide those vaccines for administration to the local public health authority on behalf of the City of Toronto. Of course, ours is Toronto Public Health. Our responsibility as a city is, of course, to receive the vaccines from the province of Ontario and then to administer those vaccines in accordance with the provincially mandated prioritization. And then, of course, there are some liaison roles. So that work of ensuring that we are absolutely ready to launch what Dr. de Villa referred to as the mass COVID-19 immunization process, that work is very much underway and has been for a number of weeks. It is the principal and, in fact, the only mandate of the Immunization Task Force, and we are well underway with that work, literally ongoing on a daily basis, 7 days a week.
I think Mayor Tory wants to add something as well. Jennifer?
Jennifer, I just wanted to add that I chaired a meeting, as we do every Monday, of the GTHA mayors and chairs, the regional chairs today, and that they, in the statement issued after that meeting, were unanimous in simply pointing out that the responsibilities that will be assigned to municipalities, to local public health authorities and cities, will be, as described, extensive and expensive, and that we will need both human resources and financial help in making sure that we can properly carry out those duties, so that this is a request. While we may have made a request through, or will make one through the Board of Health's report, this is something that is shared by all of the municipalities represented in the Greater Toronto and Hamilton area, the biggest ones.
And just to follow up quickly, Dr. de Villa, we heard sort of broad categories of people the province is prioritizing for rollout. PSWs, essential caregivers, a lot of frontline healthcare workers, which I think a lot of Torontonians had expected. But I just wondered if you could comment on that prioritization and if you think there's any groups in Toronto's unique context that might be missing.
So as per what you've just heard from Chief Pegg, this is a provincial mandate to do, and it actually does line up with what was provided by the National Advisory Committee on Immunization. So not particularly surprised to hear that which the province announced today, particularly for seniors, or the older members of our community, and those in particular who live in congregate settings and the people who take care of them. We know that that particular segment of our population has been incredibly hard hit by COVID-19 and is vulnerable to the most severe and serious of outcomes associated with COVID-19. And it looks like, what the province has announced lines up nicely with that which the Federal Committee of Immunization Experts has provided for. And I think it seems like an appropriate approach.
All right, thank you. We'll go next to Mark McAllister from City News. Go ahead, Mark.
Thank you. Very quickly, Dr. de Villa, if you could, you've also got a community survey that has been finished and is going to the board next week. I'm just wondering your initial thoughts based on the results that came back.
So are you, Mark, you were asking about my thoughts on the results of the survey?
The community survey, correct.
Yeah, so again, I think it was a very comprehensive survey that covered a number of different areas. And, I think that it speaks to the community support for the kinds of actions that we've taken thus far. And frankly, has also spoken to the very real experience of our community and the fatigue that they are experiencing and the challenges that they are experiencing as a result of COVID-19. And, at a personal level, looking around at colleagues and looking around at people with whom I have the opportunity to interact, even within the realm of public health, we feel many of those same pressures and challenges and concerns that were expressed by the community survey, or that we saw expressed through the results of the community survey. So, we're quite sympathetic to that which Torontonians described as their experience and their concerns.
Mark, you need to unmute if you have a follow-up, please. There you go.
I apologize. Beyond the fatigue, I'm just wondering if you could speak to how people perceive the level of risk to be. 64% of people say that the level of risk to the city is high, but just 32% of people that were surveyed said personally they don't believe that they'll be getting the virus in any way.
Yeah, Mark, I think this speaks to many of the challenges around COVID-19 and, many of the challenges related to the experiences that people are having. People are, I think, quite cognizant, as expressed through the survey, of risk. But I think that it is always challenging to understand how then to apply that within one's own personal life and how that should therefore change their behaviors and courses of action, because those have very specific and individual implications and consequences. So again, I think it speaks to human nature. I think it speaks to the many challenges that we all experience as part of COVID-19. And I think it tells us a little bit about the kind of ongoing communications we need to continue to have. It speaks to the benefit for having the three of us here on a regular basis speaking to Torontonians so that they understand the nature of the disease, the risk it presents to them, and what they can do on a day-to-day basis to protect themselves and their families.
Okay, thank you. We'll go next to Nick Boisvert from CBC News. Nick, go ahead.
Hi, for Dr. de Villa, please. I won't ask you again to predict 2 weeks from now, but I'm wondering if you can just be maybe a bit more specific about what you're going to be looking for this week now that we're in this period where you might expect to see some of the effects of the lockdown measures. Is it flattened cases, ICU admissions? Do you want to see things going down? Like what do you need to see this week to help you make that decision about what's next?
So, Nick, I don't know that there's one particular indicator that we look at. Certainly, I know that, my team and I met early this morning. We meet every day, but we have particular conversations coming up, not surprisingly this week, given where we are in that 28-day period, as I'm sure you can appreciate. Certainly, we want to look at, the age groups who are impacted. What are we seeing? In terms of, where cases are arising. What are we seeing in terms of hospitalizations and the impact on health care, given how significant that is, not only for the healthcare sector itself, but frankly for us as a community. So we look at all the different indicators, and I think for members of the public who are interested in following along, I would encourage having a look at the monitoring dashboard. That gives many of the major categories of indicators that we look at in order for us to inform our own decisions and actions and advice that we would proffer not only for ourselves, but as well to our provincial counterparts.
And a follow-up for Dr. de Villa and maybe Mayor Tory as well. We've heard from some doctors and other experts who have said that a framework of some kind of regional lockdown might work a little bit better since people travel around the GTA quite freely. Do you think that would help? And if not, are there what's sort of the next level of restrictions that you think might help if we're not seeing an improvement over the next little while?
Well, I think that's there's a very real concern around movement of people in and around different communities and from one community to the next, which is why we're constantly emphasizing that fundamentally the advice that we have right now for all Ontarians, regardless of which community they live in, is to try to really stay at home as much as possible and to limit their interaction to the greatest extent possible to the people with whom they live. This is how you actually reduce the risk overall for the entire province in terms of COVID-19 and all the consequences that arise as a result of COVID-19 infections, particularly growing COVID-19 infections. So, while I think there is some merit to at least considering and having discussions around how best to limit the movement of people, fundamentally, if people do stick to the rules for self-protection, really focus on staying home as much as possible, wherever possible, recognizing that this isn't a course of action that not everyone can work from home, so not everyone can stay home to the same extent. But imagine if everybody actually did stay at home as much as they possibly could, took those steps for self-protection, really limited their interactions to those with whom they live, and wore their masks as much as possible when they're outside the house, washed hands, stayed home when sick. we would see a very, very different situation in respect of COVID-19, not only in this city, but I would argue throughout the province.
Thank you. We'll go next to.
Oh, he'd asked if I want to comment.
Oh, I'm sorry. I apologize.
I will just say this. If you look last week at the meeting that we had of the GTHA mayors and chairs, even some of the regions that might have been beneficiaries of people traveling from areas where there's a greater degree of lockdown to ones that are not as restricted said, please don't engage in region hopping. And I think it does come back to people just engaging in personal responsibility and certainly as regards things like shopping and so on, just staying home and staying in their own region and for that matter, as far as possible, in their own home. It is one of those things where, again, if you said you were going to try and preclude people from moving back and forth between regions, I don't know how you do that. Are you going to have people start scanning license plates? It's people that just have to decide on their own, aside from the exceptions that we've offered for people who have to go to work, people who have to go to school, shopping for groceries once a week, as not as a family outing, that people have to take a degree of personal responsibility. And this is going to be far more effective than any rules that can be brought into place, no matter how broad their application on a geographic or any other kind of basis.
Okay, thank you. We will go next to Francine Copen from the Toronto Star. Francine, go ahead.
Oh, good afternoon. My question is for Dr. de Villa. The Ipsos Reid survey that's on the Board of Health agenda found that 56% of people are tired of taking precautions related to COVID-19. How concerning a figure is that for you?
You know, Francine, I think it's interesting that it's actually, you know, that 56% said that they're tired of taking precautions. I might have thought that it would be higher than that because I think we're all tired. But that doesn't mean we should stop doing that. I think it's okay to be tired and to be frustrated. I think that's a very human and a very real experience. But I think that as I think about it, as tired and frustrated as I might be, I think about what's best for my own health, what's best for the health of my family, and how best I can contribute to the health of our community. So frustration, tired is okay. I would just ask that people push through that frustration and the tired, recognizing that our ability to get back to the kind of lives that we would like to have next year rests on our ability to be able to stay disciplined, to focus our efforts on continued practice of those self-protection measures, staying home as much as possible, reducing our contact as much as possible to those with whom we live, so that we can get back to life more as we knew it.
My second question is for Chief Pegg as head of the Immunization Task Force. It looks like the vaccines are going to be delivered more quickly than anticipated, and I'm wondering how close is Toronto to being able to get the first dose of vaccine into the first arm? How close are you to be able to do that?
So I can say that that we are hard at work and have been for a number of weeks now, and I would say I would describe our current state of progress as very, very good. That work is continuing literally every day. The news we saw today, I'm excited by. I think that's great news, and the fact that this is very much an evolving situation is consistent with what we have seen throughout the COVID-19 pandemic, and that's certainly a circumstance that we on the Immunization Task Force expect to see continue. We really expect to see things develop on a day-to-day and perhaps even an hour-to-hour basis. So the work is ongoing. We have yet to receive any indication or any firm indication from the province with respect to delivery time to us. As soon as that is provided, I am fully confident we will be prepared and able to proceed without any delay.
Okay, thank you. We go next to Mike Walker from CTV News. Go ahead, Mike.
Hi there. Thank you for taking my question. Just following up on the vaccine rollout when it does come to Toronto, can you specify, is there a dollar value right now on how much funding we are asking for the immunization?
So to that question, I don't have the exact figure here with us. Clearly, we have a number of different elements that need to be considered as part of that calculation. But as I've said before, this has been the kind of thing that has been, that the provincial counterparts of whom the ask is being made are quite familiar with. And I expect that we should, get a positive response from our provincial counterparts, just given the nature of the request and the nature of the service that's required in order to deliver, mass immunizations to support and protect our community from COVID-19.
May I just say that if you look at every aspect of this pandemic, I think the governments in areas like this, especially public health, but some of the other areas have been very good and very accommodating when it came to saying to us, well, we're going to give you the criteria within which we will provide you with funding, and we'll see where the numbers end up in terms of the amount in question. But they've given us, in principle, the backing that we've needed, and I think they've been very consistent about that. And so I would expect that the same will happen here, and that the request we'll make for funding is more a request in principle to support in certain areas of funding. And I would add, the mayors today talked about human resources, and I think we'll need some help in that area as well. But that rarely are you able to, in advance, state the number. But I think they've been pretty good at stepping up and saying they will help, and then we provide them with the backup data later to determine the exact amount.
Okay, thank you. And just to follow up with the mobile testing that will roll out this week in some of the hardest hit neighborhoods, I might have missed it. I'm just wondering if you can provide some specifics on exactly when that will start, how many of those buses are going through, and how we will determine who we're testing.
Do you have that, Dr. de Villa?
Do you have SDF&A on the line? They've got more specific.
Just, sorry, Mike, I'm just seeing if we have somebody on the line from the EOC. We do not.
Okay. So I'm afraid I don't have the exact locations and specific times for those to happen, but certainly we can get back to you offline.
Yeah, we'll send those to you, Mike.
Sorry, Mike.
That's okay. Thank you.
Okay, thank you. We'll go next to Steve Ryan from CP24. Steve, go ahead.
Yes, thank you for taking my question. My question is for Chief Pegg. Sir, when the rollout of the vaccine begins, who will determine the vaccination locations, and what criteria will be used to make that determination as to where those vaccination sites are set up?
Thanks, Steve. So as we talked about, I'll start by saying, as we said earlier, Steve, the province of Ontario determines the prioritization, I would say the distribution priority for all of the vaccines. Our immunization task force, meaning the City of Toronto's immunization task force, is hard at work now at determining the significant number of sites and locations that we forecast will be necessary. We're looking at a hybrid model that will include, or we anticipate at least, will include larger sites with a number of satellite or more ad hoc sites based on individual need. The specific, Steve, of the actual deployment very much in development and is evolving, as we said earlier, on a day-to-day and sometimes even an hour-to-hour basis as we receive updated information from General Hillier's team at the province. So something we're working hard on. Our facilities management folks are directly connected. They're an integral part of the immunization task force working on securing and identifying and locking down the various facilities that we need, and I have every confidence they'll be in place and ready to go.
Thank you. And Chief Pegg, my follow-up is for you as well. Given the worldwide demand for this vaccine, is there security concerns with regards to, well, you know how the criminal mind thinks, right, with regards to opportunities, take advantage of, exploit others and things. Is there concern with regards to this vaccination, and are law enforcement going to be involved with regards to security?
Sure, good question, Steve. So certainly there are a number of provisions that are being taken. Both the provision of security and law enforcement, and by way of our colleagues at Toronto Police, are actively involved. They are permanent members, if you will, of the immunization task force. So as the plans are rolling out, one of the aspects that is being planned and being developed literally as we sit here is both a safety and a security plan. That includes work that will be taken by the city's corporate security division. It also includes proactive and responsive work that will come at the hands of our colleagues at Toronto Police. So very much an important aspect. It will be planned proactively, and we will ensure that everything is in place such that everything to the greatest extent possible is prevented going in, and of course making sure that we're prepared to respond in the event that a situation arises throughout the rollout of the immunization program.
Okay, final question is to Manuela Vega from the Toronto Star. Go ahead, Manuela.
Good afternoon, thank you. I have a question for Mayor Tory. On Friday, one person was arrested in connection to a pair of nooses that were found on a construction site near Michael Garron Hospital over the summer. This was one of a number of hate incidents at the hospital's construction sites. So my question for you is, what are your thoughts on the arrest 2 months after you held a meeting with construction union leaders about anti-Black racism?
Well, I think the first thing that I should say is it's excellent police work on the part of our Toronto Police Service. I spoke with the chief about it on Friday, and I think that this is the kind of police work that people want to see, where someone is brought to justice, and they will have their day in court, of course, but that there's a lot of good police work that's gone into finding and making an arrest in this case. I think the longer term challenge that rests in front of us, and we've begun work on that. The industry has, the construction industry, the unions are very involved in this. I'm trying to show a leadership role in terms of bringing people together to say that we are going to focus on the anti-Black and other forms of racism and discrimination that still exist on construction sites, as they do elsewhere. It's not confined to that at all. But that's an industry where we've had these incidents in more than one place, not just at the hospital, and I'm very determined as mayor, and I think the people in the industry and the people in the unions are equally determined to make sure that becomes a thing of the past, and that the industry itself becomes a more inclusive industry, which I think will help a lot with prevailing attitudes and practices, which are not widespread. This again represents the behavior of a tiny, tiny group of people, but nonetheless, it is something that confronts us every day in the city.
Thank you very much.
No follow-up, Manuela? Nope.
That's all right, thank you.
Okay, all right, thanks very much. Thank you, everybody, for joining us. That concludes today's briefing. We'll return here on Wednesday. Please stay safe.